Basically, postnatal care commences once a mum has delivered, and if she's in hospital and she's decided that she's going to stay for 6 hours or she's going to stay for 24 hours, the length of time that a mum will stay in hospital is very much dictated by how well her and the baby are. It's also dictated by the type of delivery that she's had. So a lady that's had a normal vaginal delivery who's very well and healthy and there's no problems with the baby can be discharged after 6 hours, where a mum who's had a caesarean section will often stay 3 to 4 days. The concept of postnatal care once a mum has been discharged home is that a midwife will come and see you and your baby at home, ensure that if you are breastfeeding, that the breastfeeding is going well, that physically you're reverting back to normal, that the discharge that you have has not increased, that it's not offensive, that the baby is gaining weight, those sort of very basic things that we do. The positive aspects of postnatal care in relation to the baby will be a baby that's thriving. In other words, breastfeeding or bottle feeding if the mum chooses to do so, weight gain, a baby that's not dehydrated, a baby that's not jaundiced. Most babies for the first 3 days of life can sort of develop jaundice after that, and it's the normal physiological jaundice and we don't worry about it. But persistent jaundice, particularly where a baby is lethargic, where the sclera, the whites of the eyes are yellow, those would be causes for concern, and the midwife looking after you, the onus is on her to be aware of that and have you readmitted into hospital if necessary. From the mum's perspective, we would expect a mum that's breastfeeding well, that's feeling very happy with the baby, that if she's had a caesarean section or if she's had a vaginal delivery where there's any tears in the perineum, that they're healing well and that there's no infection.